April 10th. So make sure that y'all set up y'all's appointments with your advisors if you have it. Get registered, especially if you're taking those A&P classes to those like
quick.
A&P 1 and A&P 2, like within that day, they're some of them are closed. So make sure you set up an appointment with your advisor, and then also if you haven't done your FAFSA, your renewal for 2026, 2027, that is ongoing. So make sure you get that done and hopefully awarded before you leave the semester. Okay. So if you need help with that, let us know. Also, we're going to be taking a trip to Eastern New Mexico. So if anybody's interested in going there with us in April, we'll have a signature page soon. So we'll send you information on that. But other than that, we'll have spring break next week. So y'all make sure y'all catch up on y'all's work, right?
Yes.
But yeah, we have Jessica Williams here. She's MSN and RN.
Yes.
Right. Yeah. So I think she's gonna tell you a little bit about herself too. So she's got a great story. So thank you very much for presenting to our students.
Yes. Thank you for being here. So again, I'm Jessica Williams. I am a master's prepared RN. So my journey, I'll tell you a little bit about my journey as we get through this little PowerPoint that I put together. I'm actually going to talk about all the different programs that we have here at South Plains College, because we do have the ones here in Levelland, but we also have some of our other programs in Reese, in Lubbock, and then in Plainview. And so let me just go ahead and get started. So I just want to start in our vocational nursing program. So vocational nursing is for your LVN. Okay, that's your licensed vocational nursing license. Okay, and so for vocational nursing program, we do have it's only 1 year. Okay, we do have 3 programs here at South Plains College for that. So with that, there's no prerequisites. Okay, you can just get in and get started. Okay, this is where I started. Okay. And so these are 48 semester credit hours. And so you will graduate with a certificate of proficiency. Okay. So you don't actually get a degree, but you get that certificate of proficiency. Okay. And then also you can sit for the NCLEX. Our NCLEX is the board test that we take so you can get your actual license. So anywhere you go, if you go for RN school or LVN school, you have to go through the full program, and then when you pass that program, then you have to sit for a test for your licensure, okay? And then that licensure helps you get your job, and you're ready to work. You get that good pay, okay? And then again, like I said, you get to sit for your NCLEX, and then you get your LVN license. So like I said, we have 3 campuses: Levelland, Plainview, and Reese, Lubbock, okay? Reese is the one that I went to. Usually their school days are going to be Monday through Friday. So Monday through Friday, they'll have class time, and then you'll have to also go to clinical during that week. Okay. So sometimes they do clinical like Monday, Tuesdays, and then the rest of the week they'll have class time where you're doing, your tests, lecture, or skills, checking off those types of things. Okay. So, our clinicals, we usually try to do wherever level you're at, that's where you're going, okay? So you'll probably go to long-term facilities, hospitals, the centers around. I mean, we try to get y'all as much experience as we can before you actually go out there, okay? So for requirements for admission, you do have to make sure you have your high school diploma or GED. You want to make sure that you do good on your T's, okay? So when you put in your application, you get ready for your application, we go off a point system. So the more that the higher the scores that you have, even if you do prerequisites, okay? Like say you do prerequisites in for A&P in English, those types of things, we'll even count those as points as well, okay? So we go off a point system, and the higher points you are, the more we're looking at you, okay, to bring you in our program, okay? And so when it comes to those T scores, you definitely want to make sure those T scores are high. Okay. I do know that the 58.7 is just the minimum, but you want to think higher, especially with that science, because even though we may not, it's only 40% of the points, you want to make sure that it's higher. okay? Because we look at that science. So we also want to make sure you're TSI compliant. You can have a 2.0 grade point average. And then also your CPR certification. I will tell you, you don't have to have that before, because we actually will, once you get into our program and you start your orientation, we'll actually get you CPR certified. I'll be the one to teach you, myself or one of the other instructors, because we're all BLS instructors as well. And so don't worry about that part, but you will have to get that. But if you have it, that's even better. Again, once you graduate from the LVN program, you'll have your certificate of proficiency, you'll qualify to take NCLEX, and then you'll get your LVN license. Okay. So when you're like, well, what does an LVN do? Like, why LVN? Okay. So LVNs were brought in to help assist the RN. Okay. But as time has gone on, and there's a shortage of nursing, and the ratios to nurse to patient are so high, LVNs actually do, carry a lot more, okay, have a lot more responsibilities, and they're also able to move a lot more in different areas, okay? So some of the areas here, some areas you can be a supervisor, especially in your long-term facilities, okay? I've known some LVNs that have graduated and they become the, director of nursing over some of the long-term facilities, okay? And then they can also work in the hospital as far as like med-surg floors, which med-surg floors are like a combination of all types of illnesses that you're taking care of. Renal floors, some oncology, only because you have to have a certain certification and they expect for oncology caregivers to have an RN, okay? So, but there's some things that you can do, because I remember when I was an LVN, I was able to be an oncologist, just, for only a little group of oncology patients, okay? And then, of course, pediatrics. So there's a lot of things there in the hospital. Also, clinics, mainly a lot of your clinics that you go see, your PCP, things like that, they're going to have LVNs there in that clinic. Home health also have a lot. And so home health is where they actually go out to the homes and take care of the patients. And then a lot of your rural areas, hospice has LVNs. And again, a lot of your nursing homes carry LVNs. Okay, so there's a lot of things that you can do as an LVN. All right, so we're going to kind of switch a little bit and look at our ADN program, our RN program. Okay, so I'm going to talk about our traditional track. This is our generic track. Okay, this is a 2-year program. Okay. You do have prerequisites, okay, and I have all the information up here, okay, and so that's a 60 semester credit hour program. So you will graduate with your ADN, that's associate degree in nursing, okay, it's a really good degree, and then you'll also get to sit for NCLEX for your RN license, okay. So our main campus is here in Levelland, it's right over there, okay, where the old Mervyn's, it was Mervyn's, right? Okay, so we're right over there. We have our own little area. We have our lab there. We also go to simulation at Reese. So we have a simulation lab at Reese, and I have some pictures here, and where we have, mannequins, fake patients, however you want to say it, that talk and, breathe. And we have a mannequin that can birth a baby. Yes. It's really cool. I actually have a picture. Well, not like the whole picture. I only have the back part of the picture. So you can see, but we usually will go to Reese to do those simulations before we actually go into the hospital. Okay. Just to kind of give you all some experience there. So when it comes to admission requirements, okay, again, you got to make sure that you complete your packet online. And I do have packets today. I have information and packets, okay? So you also want to make sure that you've applied here, you have TSI compliant. For the TEAS test, again, you want to make sure you're hitting that 58.7, right? But on the science, they're looking for a 50 or above, okay? Right, we're looking for 50 for above. We also like a GPA 2.5. If you can get higher than that, that also adds more points, because we do the same thing as far as the point system for the RN program. And then And we also want to make sure your prerequisites are C or better. I am going to tell you, okay, your A&P courses are very important, okay, because once you come to us, that's all we're talking about is the body, okay. And then when we start moving up, we start talking about diseases and disease processes, and so that A&P is so important to have and retain, okay. So make sure that when you're doing your A&P that you're really working hard, studying, focusing on how that body is working. Because when you come to us, I mean, we're already talking about, hey, hypertension, diabetes. We're talking about all these things and how the body's being broken. And it's very important that you have a really strong foundation in your A&P, okay? All right. And so when it comes to, and that's a big thing too, because when it comes to A&P, those are the main things that we're looking at. That's if you do really well at A&P, if you get A's and B's in there, that's really good. Okay. If you get 1C, that's fine, but we really would like for you to push for that A or B. Okay, if you can. So like I said, A&P 1 and 2 is very important, and it has to be completed within 5 years. Okay. So if your A&P lapses past 5 years, then you're going to have to retake it. So that's another thing too. Okay. So you want to think about it, because by 5 years, if you've taken A&P, you're probably not going to remember it. That's one thing that we see. Okay. So that's another reason why we want to make sure that your A&P is nice and fresh. Also, we take English 1 as well. So make sure you do really well in your English 1. Okay. So those 3 prerequisites are the biggest ones that we need. Okay. And then also CPR certification, but again, we don't really worry about that at the very beginning, because we will take care of that for you when you come in orientation. And your CPR, your BLS will be good for 2 years, so you're good until you go to work. Okay, after you're done with your 2 years. So when it comes to an RN, okay, we can pretty much do a lot of things. Okay, we pretty much can do pretty much everything. Okay. We're pretty much the responsible one on the floor. We can be charge nurses, nurse managers, but the biggest thing is when you first get out there, you've got to get your experience, okay? So to step up that ladder, okay? So with the hospitals, we have all areas, emergency room, and ICUs, labor and delivery, because LVNs can't go to a lot of these areas, okay? But RNs can. You also see RNs in clinics. We still work home health, hospice, but RNs also do case management as well. That's a really big responsibility, okay, is case management RNs. But before you can get to case management RN, they do like to make sure you have some hospital, some experience, okay? But case management RNs are the ones that actually help the patients, taking care of their meds, making sure that they have everything that they need at home, like home health and stuff, so they're taken care of at home, because patients don't stay all the time at the hospital, right? And so case management is such an important part of nursing. And then, of course, like I said, charge nurse, nurse supervisor, nurse educator, okay? And, of course, any type of director of nurses, okay? So, again, there's a vast variety of things that we do. There's also travel nursing that you can do. A lot of our students, go to the hospital, then they go travel and do all the things and get more experience. So the newest thing that we've started is the paramedic or LVN to RN bridge program. Okay. So this here is open for licensed paramedics, okay, and LVNs who've had at least 1 year of experience in the field. Okay. And so with this program, it's only a year. So we go from August to August. Okay. And so the days that we come, we only do like half the week. Okay. With this program. But it's hybrid. So hybrid means we have a portion of our courses online. Okay. And then a little bit more of a portion in person. Okay. And the reason why we have more face-to-face and in person is because we have to do clinicals. And clinicals is face-to-face, right? But we do have class in face-to-face, and then, like I said, a big portion or a smaller portion online. So again, this is only 3 consecutive semesters. It's August to August. It is at the end, you'll still receive the full 60 semester credit hours. So that will get you your ADN. So transition bridge program doesn't really have a difference except for what they're going through, okay? Except for the path. They have a different path than a traditional RN student. So they still have to make sure they're TSI compliant. They have to make sure they have the same T scores, okay? They still have to make sure that they have the GPA, but our GPA is going to be a 2.7 for prerequisite, okay? So it's just a little bit higher, right? And then they still have to make sure they have the same sciences and English prerequisites, okay? So the only thing that's different here is going to be this test. Can you see my little arrow? This test right here. And it's called critical thinking assessment, okay? That's the only extra thing that my bridge program students have to take before they come in. And that helps me kind of understand their experience, okay? So myself, the dean, and our admission committee will look at those results and kind of see how well, they understand critical thinking, critical judgment, and those types of things. Because I'm not going to lie, this transition program goes really quick, okay? It's pretty fast paced. So, but at the end of the day, they'll still graduate with their associate degree in nursing, and then they will also be able to sit for RN license and then get their RN license. So at the end of the day, pick your spot, okay? Pick your place, wherever you want to go. I always tell people who come and talk to me, don't put all your eggs in one basket, okay? When I started my journey, I went ahead and put my application at SPC ADN program, SPC LVN program, and I also put it in the covenant, okay, right? And so when I did that, because I was like, I'm not putting my eggs in one basket, because I don't know what's going to happen. And so out of all those 3 places, LVN was the only one that accepted me at that time, okay? So I went to Reese LVN program, did that for a year, okay? I got my LVN license. It was a great experience. I had a really good experience there. The teachers really made sure they taught me what I needed to know to get on the floor as an LVN. So I was actually hired before I even graduated. Okay, so I mean that just to tell you, this area really loves our SPC students. Okay, and so I worked for about 4 years, four and a half years in the hospital, and then I went back for my ADN. Okay, I did it again. I didn't put everything in one basket. I signed up for another nursing program, and then I signed up for SPC ADN. So I got in at SPC ADN. Okay, so I went to the transition program here, which is not the same as it is here, but I went to the transition program here at SPC and got my ADN through them. And right now, I still work with those people that taught me, and I just love it. Right? It's a good turnaround. But it was a great experience. I was able to get my ADN. I still worked in the hospital, and then I went ahead and I got my BSN from LCU, and then I worked at Covenant Hospital for about 7.5 years. And then I worked at Texas Tech Health Science Center in the cardiovascular clinic. I worked there for about 2 years, okay, and then I started teaching the LVN program shortly right after that. And so I've been here for 10 years so far. So I started off working the LVN program. That's where I got my master's is when I was working. I got my master's through GCU, Grand Canyon University. It was all online. And so I got my master's through there, and then I moved and went to the ADN program, was able to work there. So as you can tell with my nursing path, right, Yes, it took a little longer, but for me, I feel like I learned a lot. I have a vast variety of experience. If you look at my resume, because of all the things that I pushed myself to do. Okay. And you can do the same thing too. But again, your journey is not going to look like mine. And also you can still do the same things going to your traditional RN program. Okay. I have students right now that just graduated December with their ADN because they went through the tradition. So they just graduated with their ADN December, and they will graduate with their BSN in May from Tech. You know what I mean? So then that's their path, right? They work at UMC doing all the things. Okay. So everybody has a different path. You just have to know which direction you want to go. Okay. And making sure that you, wherever classes that you're taking, that you do really well. Okay. Do really well in. And if you ever have any questions, always just call us there at the office for sure. You can always call me, ask for me, and I will tell you, hey, this is where you need to go, or this is where I think you should do. Okay. And, but I'm always going to tell you South Plains College is it. You know, I was homegrown South Plains College. So, but yes. And that's all. That's all that I have for you. Do you have any questions?
I have a question.
Yes.
I know you were talking about like a point system and with the certifications. If I have multiple certifications, will that help the point system?
Yes. So if you come in, say you have your PCA, CNA, CMA, whatever, right? EMT, because we get EMTs as well, right? If you come with all that, it counts as we add that on our point system.
Okay.
Oh yeah, we look at all of that.
I have a question.
Yes,
For
ma'am.
the NCLEX, is it the same as the RN NCLEX for the LVN, or is it a little different?
It's a little bit different.
Okay.
Yeah. So when I took, it's a little bit different. So it's not as in depth probably as your RN. So, but I will tell you, when I took my LVN, it was hard in class because I had never done it before. But then I felt like it helped me for my RN NCLEX, because when I took my RN NCLEX, I mean, I was done immediately, and then I was like, okay, that was too easy. Give me more questions, like what's going on? You know what I mean?
Yes.
And so, but I felt like for me, I needed that. I needed that. So, but yes, LVN is just a little bit different than RN. They're still going to test you. And like I always tell people, when you take your NCLEX, they don't care about your experience. They want to know, can this person protect and keep this patient safe with the education that they got?
Okay.
That's all they care about. So, any other questions? Is anybody really interested going to nursing? Okay. So what would you, where are you at? What are you thinking?
I want to get into the RN program.
Okay.
I'm finishing up my prereq so I could apply to the RN program.
Okay. So are you not finished with your prereqs right now?
No,
Okay.
I just I have A&P 2 left.
Good. Keep it going.
Same.
Same. Do you still have one more class?
And an LVN for me.
Oh, LVN. Yay. Okay. So for LVN, I do know that for the Reese program, I think Reese in Plainview, their application is due April 15th. So theirs is due April 15th. Maybe, hold on, I just picked up the wrong one. That was the bridge program. Their application is due April 29th for Reese in Plainview.
Okay.
So I have information, but I also have applications.
So she could already
She
apply.
could
Yeah.
already apply
Okay.
like today. So, yep, and I have one right here for you. Yes,
From
ma'am.
an advising standpoint, the main question we get is, should I do LVN or RN? Is there a particular, and obviously the biggest thing is, well, do you want to do prereqs or not? You have to go into the one. Is there a particular type of students or otherwise that you would recommend doing LVN first and then RN? Or is it just based on whether you want to do prereqs or not? How would you answer that question, I guess?
So usually, well, Well, also too, I kind of look at like how fast do you want to get into the work field? How fast do you need to work? I mean, because we all do these programs, get our license, because obviously we want the better life, to have money, insurance, all the things, right? And so that's another question I would probably ask. It's like, okay, where do you see yourself? Do you need, a job soon or later? Okay. And so if it was sooner, I'd be like, okay, well then you need to probably just go ahead and do LVN, since there's no prerequisites, and go ahead and get that started. And as you work as an LVN, find a facility that will help pay for your schooling and help pay for college courses so you can work up to your RN. But if they have the time and they're like, well, maybe, I have time, or I'm not really worried about getting it, I want to get it as soon as I can, whatever, I would say then maybe do the RN, so they have the time to do their prerequisites, so they're not failing their prerequisites all the time, that they can sit there, focus on their prerequisites, and then go to school, focus on school, and then be able to work. So it's just kind of where their place is in their life and what they're looking for. It's not a particular, if they're a weak student or strong student. It's what do you feel like you need? Like, do you need something, a trade that's quick and get you in there so you can start working? Or do you have time to be able to work this out? Because it's going to take time for the RN, program, because they got to do the prerequisites. It takes 2 years. LVN, they can get in there, get it done, and then they can work while they're working on their RN, prerequisites for the RN. So that's probably something that you can throw out there too when you're talking to them.
So if you apply now and I haven't taken like my TEAS test, or if I'm still working on my TEAS compliance, is that going to affect my applying?
So what will happen is yes, we would like for you to have it completed, but if you're already scheduled and you let us know that I put in my application, but I have my TEAS only scheduled, because we know TEAS test. I mean, we know everybody's getting in there. I mean, we know how packed that is. And so then all you just need to do is tell us, say, hey, I'm not hey, but ma'am, don't say hey. Just go ahead and let us know that I have my TEAS test scheduled. I just haven't been able to take it yet. And then once you take it, then send us the scores. Okay. So, because we understand that. And same thing too, like if you're taking your A&P, right, and you're going for the fall, you want to come in fall of 26, and you're still taking your A&P, you can still apply for fall, and then once you pass or whatever, we'll look at your grade, and then we can pull you in. Okay, just so you can have us under, or have your name under our radar. Okay, because we'll be like, hey, where was that one student that had, her CNA, and we'll ask.
Mm-hmm.
They're like, oh, well, she's still taking her A&P, but we're just gonna wait for her. Okay.
So if we were to apply for the fall of this year,
Mm-hmm.
would that mean I would have to be in a rush to end up taking the TEAS as soon as I'm done with my A&P?
I mean, no, not really, but I would say work on, if you can take your TEAS right now, because, and also be careful how many times you have to do it. Okay. So you want to take your time doing that and getting that done right. But like I said, if you're still working on things, just make sure you put that on the application and just let us know. Okay. And we'll take all of that in consideration.
Is there a limit on how many times you can take the test, or?
So as far as the TEAS, I think it's 3 times. As far as A&P, I think it's 3 times. So
the test is like, if you take it 3 times and you don't.
And you
pass
keep
it,
on
then
failing.
You can't.
Yeah.
They won't.
We'll have to look at that and be like, sorry. Yeah. So we look at how many times you've taken A&P, taken your TEAS.
Right.
We do look at everything.
That's good.
Is there a certain time where that resets? Like, let's say a student, they tried, it didn't work, they tried 3 times, and then they go off to do something else, they come back, and, they're older now, they want to try it again.
Yeah.
How long do
yeah,
they
we
have to
take
wait
that.
in between?
So as far as the time, I would have to talk to our dean about that.
Okay.
But we do see that too, because we'll see that track. Because we'll see, oh, okay, over here, they took A&P 2 times, and then it's been a couple of years, and then they took A&P again and did well. You know what I mean? So we see that they're all, obviously there was some maturity that happened within that time.
Yeah.
Yeah, so we do look at that as well. And we do take that in consideration. But as far as the time, I don't know.
Okay.
I would have to ask our dean, like, is there a set time that we would really want to, in between taking A&P and the T so many times. So, but we do track that, and we also look at that as well.
Okay. So if we have a student, best case is just send them over to y'all and be like, hey, discuss that with them and see what they
Yes,
kind of
send
feel
them to
about
us, and we'll look at all their transcripts and how many times they've taken it, talk with the student and things like that, and just see where they're at.
Also for the T's, if you can't get into SPC here or Reese, where else can you take the T's test?
Well, I think there's one at Byron Martin too. I think there's a T's. Is there a testing facility there as well?
Yeah, Barmine, yeah.
Yeah,
Or the CT.
yeah, the CT building.
Yeah.
Oh, okay.
Yeah, so I knew there was 3 spots. So there's Reese here and then over there in the Lubbock facility by on Q.
But no, like if it's not SPC school, is there anywhere else like a tech or like Texas Tech or anywhere else that offers that T's test?
I'm not sure.
Okay.
I
I'm
think
not
it needs to be done at the
I think it
school.
has to be
that
done
you-
here.
Yeah, I know LCU does require them. I mean, Covenant, excuse me. Covenant requires it to be done at the Covenant
After,
school. Yeah.
okay.
Yeah. Yeah, I think we're the same too.
Okay.
We want it from here.
I'm kind of curious, what's the pay range as far as for like LVN, RN, starting out? Is there like a big-
It all depends on where you're at. Because if I talk to you about my pay range, you'll be like, nah. When I started, because it's changed a lot from when I started. So LVNs do not start like I did. So I was real low, and I would thought it was great. I mean, for me, it was great because I didn't have a job. You know what I mean? The job that I had, was just paying, minimum wage. You know what I mean? And so when I went to the hospital and they paid differential, I was getting insurance. They helped me pay for child care. I mean, things all like that. Well, because I was in that Covenant system working there. It was worth it to me. Until I did realize how the difference was in pay. And I was like, okay, it's time to go back. Yeah. But Covenant paid, at that time, I don't know about now, but Covenant did pay for my school. Did a tuition reimbursement at that time. And then when I was going to RN school, I actually was put on a program that they would pay me for 36 hours and I only had or 32 hours and I only had to work 24. So I was able to work and go to school when I was in a transition program. And so I would go to school all week, work on the weekends, and I would still get paid. And so that helped me out a lot during that season. And then of course, once I became an RN, the pay was significantly more, pretty much doubled than what I did as an LVN. Nowadays, the pay is a little bit different than what it was 10 years ago. So, but yes, there is a difference. But like again, it just all depends where you're at, where you go, when it comes to LVN. Anything else? So I have information packets here. This one right here has for all of the 3 programs. Okay. This one right here is specific to towards the RN program and the transition program. And then this one right here is for the LVN program. Okay. And if you're wanting to go ahead and have a packet to actually apply, I have that here as well. Okay. All right. Well, thank y'all so much.
Thank you.
Thank you for all the questions.
Yeah. If you can fill out the survey and then we're gonna do the door prizes. So